G'day everyone, hope everyone's well. Enjoying another winter's day in Victoria down here. You'd be forgiven to think it's 26 degrees out there at the moment, but it's beautiful blue skies. It ain't 26 degrees, I can give you the tip. Hence the reason I've still got the woolly jumper on. Anyway, about to dive into clinic, but before I do, on another quick episode of Stu's Corner, and today's is about a long-term client of mine who's an ultra-marathon runner or ultra-marathon trail runner. As you can well imagine, that a marathon's not long enough these days, so these guys have to, kick on and do 100 Ks in the day and whatever the case. But anyway, this chap's been seeing me over the years. We've had some absolutely doozies in the clinic here in terms of the stuff that he's brought in. None more so than he's come in just recently with some ITB pain, and he has had a history of ITB pain before as well, believe it or not. Quite a nasty one, and actually did blow out. He ended up having to get a cortisone injection, which did settle things down, but this time he's come back in. I hadn't seen him for quite a while. He's actually been running along beautifully at the moment. And yeah, he's just had a recent sort of upset in regards to pain around the lateral part of his knee. He's obviously at the get-go it's ITB pain, and obviously from there, that's why I thought, okay, well, let's check it out. This will make a good case study. And it does, because as we all know, there's no one definitive test for ITB pain, okay? So it's sort of, your subjective assessment is really important, nutting out when they feel it. Obviously, lateral knee pain is obviously going to be the foremost symptom there, but whereabouts around the knee is it? He came in because he had changed up a little bit of his training schedule. Once again, it all comes back to overload, doesn't it? Or changing dynamics in your load, or changing your training regime. So, it's never just one little thing, I slipped, hit my knee. No, it is an overload issue, and it is always about load management. So, no surprise that he ended up with a little bit of lateral knee pain. So when he came in, obviously as I do, I look at the hip, try and find any restrictions, which, there was one or two, but nothing magnificent. And modified Ober's test was a little bit tight in his lateral hip. So, for those of you know that my mantra for ITB pain is all about, I don't touch the ITB at all. I mean, that's a joke, this is a big, thick piece of tissue, and it's there to stabilise the lateral part of our thigh. So it has no elasticity in it. So massaging it would be just ludicrous. And for those of you that do, good luck to you. I feel sorry for your clients because it's extraordinarily painful. But if I want to change anything in tension in regards to the ITB, it is always at the hip. So that is my go-to. Clear here, clear the side, either side, vastus lateralis, and also one of the most important muscles, which I'm bringing to you today, because as much as this chap come in and had ITB pain, and I obviously palpated around here, and Gertie's tubercle where it attaches in around the fib of the head, your head of the fib and all that sort of stuff. Check the fib head, see if there was any irritation around there. Obviously at the classic signs of, running, it's getting worse and worse and worse, sort of that sort of stuff. But he was able to sort of push through it a little bit, but, given the history of having one beforehand, he didn't want to blow it up because he had an event coming and so forth. But so we definitely did have some sensitivity around here and around his ITB. Absolutely no doubt. Whether or not it was the true classic ITB wasn't really jumping off the roof for me. Anyway, I did what I normally do. I clear his hip, did my hip protocol. Obviously, spent a lot of time fascially sideline clearing out his Ober's test because it was a little bit tight. And then obviously, the piece of resistance for me was, and it always has, and I love a mimicker, and this little beautiful muscle right here, which is the short head of your biceps fem, okay? And you can see it comes down, it snugs right up against the ITB here. This, my friends, was pretty much 90% because of his issue. It certainly had issues in and around the hip, like I said, and I did do a lot of fascial work around the knee. There's absolutely no, but in terms of reproducing what he was getting, it was the short head of his biceps. And it is one of these muscles that can beautifully mimic things like ITB. And any sort of like lateral knee pain or knee pain in general, my go-to is always, addressing and seeing what's happening in the short head of biceps. And, remember, obviously I've removed the long head here. So remember, if you're trying to engage this muscle, you sort of got to have the knee bent. So it's got to be relaxed. You can slide the long head out, and then obviously there's a trigger point right behind there in the lower half here. Now, it does refer into the knee and so forth, but absolutely mimics that ITB pain just beautifully. And remember, it's a unique muscle. It's short-headed biceps fem, but in terms of all the hamstring, it actually has a different innervation as well. It's the perineal portion of the sciatic nerve as opposed to the tibial portion that innervates the other hamstring, semitendinosus, semimembranosus. Every now and then there are anomalies with this muscle where it may be actually a lot bigger and so forth. The attachment comes all the way down onto the fib head as well. So, like I said, it's that classic understanding that, are we dealing with a true ITB or are we dealing with a mimicker? And as you know, how I go about all this sort of stuff, it's all about palpation. Obviously, trial, treat, retest, see how you go. But for those of you clients coming in with ITB pain, biceps fem has to be, short-headed biceps fem has to be your go-to. Please don't ignore long-headed biceps, which is a cracker too, anomalies where the fascia continues right on up into sacral dysfunction. So that also will want to be one of your go-tos as well. Hope you're all well, guys. Looking forward to the next half of this year in warmer weather for us, and for those of you who may be in warmer weather, half your goddamn luck. We'll speak to you soon and be bloody awesome.